Hello friends, I am Dr. S. Mondal, BHMS Honours Consultant Homeopathic Physician. Today I want to discuss another very important rheumatological topic is rheumatoid arthritis. This video is basically for my non-Bengali followers and subscribers. What is rheumatoid arthritis? Rheumatoid arthritis is a chronic inflammatory disorder and it is an autoimmune disease, and that can affect mostly the joints, basically the small joint, and some people can including the symptom some systemic illness like the skin, eyes, lungs, heart and blood vessels. Autoimmune disorder. What is autoimmune disorder? Autoimmune disorder means the immune system mistakenly attack your own body tissue. When the immune system of the mankind that can affect the affect her own body tissue, that is called the autoimmunity. Auto means same. And in case of osteoarthritis, joint the damage the joint and wear and tear of the joint. In case of rheumatoid arthritis, basically affect the lining of the joint, lining of the small joint. And severe rheumatoid arthritis can still cause the physical debility or physical abnormality or physical disability. After that, we will discuss what are the causes of rheumatoid arthritis. Rheumatoid, at first I will tell, rheumatoid arthritis is an autoimmune process. When the immune system attacks the healthy tissue in your joint, and sometimes some medical condition, and it can also causes the problem with your eyes, lungs and nerves and skin. What are the risk factors? What are the risk factors of rheumatoid arthritis? Number one, your sex. Women are more developed rheumatoid arthritis than male. After that, the age. Age is a very important factor for developing the rheumatoid arthritis. Is a most commonly begin at middle ages people around the 30 to 40 years ages people. Family history in member of your family has rheumatoid arthritis, you may be increase the risk of the disease. Or family history is a very important predisposing factor. And the smoking, cigarette smoking increases the risks for developing the rheumatoid arthritis, and if you have a genetic predisposition for developing the disease, and greater the risk of severity in case of rheumatoid arthritis. Smoking, another very important factor. And excess weight, and people who have the overweight, and it can be developed the rheumatoid arthritis. After that, we will discuss symptom of the rheumatoid arthritis. Rheumatoid arthritis is an inflammatory disorder. That's why the common symptom of the inflammation are including there, like tenderness and warm and swollen joint, swelling of the joint and warm or redness and hot and tenderness. After that, the joint stiffness is a very important cardinal distinguishing symptom, and it is differ from rheumatoid arthritis and osteoarthritis. There is the joint stiffness. Basically, joint stiffness aggravate in the morning and after inactivity, especially after fast morning, after sleeping, after a long time sleeping, after a long rest, when the patient move fast in the fast motion aggravation. There is another very important symptom of Rhus toxicodendron in our medicine. And after that, the fatigue, fever and loss of appetite. This is the another symptom. Rheumatoid arthritis basically affect the smaller joint and joint around the wrist, especially the joint of the fingers. This joint are basically affected. Among in the in hands and in feet also small joint are affected. Is another very important and diagnostic symptom is rheumatoid arthritis is this is a symmetrical arrangement. Symmetrical arrangement. This is a very important. The disease progression symptom often spread the wrist joint, the knee joint and ankle joint, elbow, hip and shoulder joint. Most cases symptom occur at the same joint of the both side of the body. Same joint on the both side of the body. One affected in this wrist joint, and after that they affect the right side also. This is called the symmetrical arrangement. In 40% people, rheumatoid arthritis can also have experience and including the associated symptom like that. In case of joint pain associated with some systemic illness, like as the skin symptom may be present and eye symptom may be present, some lungs problem may be present, and heart, kidney, salivary gland, the nerve, nerve tissue, bone marrow and blood vessels also. The aura of the rheumatoid arthritis, the aura of the developing the symptoms in case of the rheumatoid arthritis, that is called the flare. And after that, after we discuss the symptom, and after that I will discuss the what are the complications of the rheumatoid arthritis. First of all, the main complication of the rheumatoid arthritis is osteoporosis. Osteoporosis, in case of rheumatoid arthritis and allopathic medication for the rheumatoid arthritis, and both are aggravate the condition and both are develop the osteoporosis, broken down the bones, the bony structure. After that, the rheumatic nodule, another very important complication. There is the firm bump tissue most commonly for around the pressure joint. Rheumatoid nodule can develop those type of joint where the pressure, continuous pressure. Dry eyes and dry mouth, most commonly seen in case of who have suffering the rheumatoid arthritis and more chance to develop the Sjogren's syndrome associated with rheumatoid arthritis, more chance for develop the Sjogren's syndrome, and that's why the symptom dry eyes and dry mouth can be developed. And after that, the infection. Rheumatoid arthritis is an autoimmune process, that's why the immune system is affected, severely affected. That's why the more chances for infection of like influenza, coronavirus and the pneumonia and Shigella, etc. Abnormal body composition, patient growing more obese. Another very important complication is the carpal tunnel syndrome. Carpal tunnel syndrome basically develop after the injury of wrist joint and compression the nerve, basically medial nerve, and pain in the joint and fingers of the wrist, of the hands. And heart problem. Rheumatoid arthritis can increase the risk of the harden and the blockage the artery and can develop the coronary artery disease or CAD. Lungs problem. In case of rheumatoid arthritis, increase the risk for developing the inflammation and scarring of the lung tissue or lung parenchymal tissue. That's why so many type of problem like as the progressive shortness of breath and emphysema can be developed. And lymphoma and rheumatoid arthritis can increase the risk for lymphoma or blood cancer. It is another very important complication of rheumatoid arthritis. Diagnosis. Rheumatoid arthritis can be difficult to diagnose in the early stage, but in later stage it can be diagnosis. First, the physical examination should be performed. In physical examination to show the swelling, the redness and warmth and reflexes and muscle strength of the person, of the patient. And after that, the blood test. And blood test basically ESR, erythrocyte sedimentation rate, and C-reactive protein should be measured. In case of rheumatoid arthritis, both are elevated enormously. And most diagnostic test is anti-CCP, anti-cyclic cerulinated peptide is the most confirmatory test for rheumatoid arthritis. After that, the imaging test, X-ray should be recommended. X-ray should be recommended, and progression of rheumatoid arthritis of the joint, MRI and ultrasound test. X-ray to show the progression of the rheumatoid arthritis of the joint over time, and MRI and ultrasound should be suggested. Lifestyle and home remedy like the regular exercise, number 1. Number 2, the apply heat or cold. Number 3, relaxation like meditation, yoga, etc., and stop smoking. Thank you.